Hello, hello, and welcome back to another chapter of the FNP Intense Review Guide. Today we're talking about Chapter 29, Evidence-Based Medicine and Epidemiology. Evidence-based medicine, the definition, is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. It is also known as evidence-based practice. There will be several questions on the American Nurse Credentialing Center, or ANCC, exam that will test your ability to sort and rate articles by the level of evidence. So, it's hierarchy of research evidence. Meta-analysis is a statistical method that combines data from multiple studies, resulting in higher statistical power and a single conclusion. This method is considered the gold standard for evaluating research evidence for evidence-based practice. Systematic review, a type of literature review that identifies, selects, and analyzes multiple research articles concerning a health condition, disease, or other health-related practices. Follows specific methodology to identify all the relevant studies on a specific topic. Studies to be included must meet explicit criteria. Studies are ranked from grade A, which is best evidence, to grade D, which is considered poor evidence. After a systematic review is done, the acceptable studies are pooled together and statistical testing of the data, the meta-analysis, is performed. Randomized controlled trials. Subjects are randomly assigned to either the control group or the treatment groups. The intervention may be a drug, procedure, or device. Some randomized controlled trials, or RCTs, use a double-blind design. The intervention is hidden from the patient, clinician, and the researcher. RCTs are experimental studies. So, experimental study. In a nutshell, an experiment involves random subject selection, one placebo or control group, and one or more intervention group. An RCT is a type of experimental study. Cohort study, a type of research that is used to investigate risk factors for disease, risk factors for death, and other conditions. The research subjects are observed for a long period. There's no intervention done, not an experiment. The goal is to identify risk factors and associations, not causations of a disease. Examples of these would be the Nurses' Health Study as a large cohort study of female nurses between age 30 to 63 who reside in the state of Massachusetts. A cohort study can be a type of prospective study, present to future. A case report, a detailed report of one patient with a disease or an unusual condition that includes demographics, signs and symptoms, diagnosis, response to treatment, and so forth. Case series, a series of case reports that involves a series of individuals who are given similar treatment. Opinions and editorials. Opinions and editorials can be biased and may not be based on solid evidence. They are the weakest form of evidence. Research databases. Cochrane reviews, the gold standard databases and resources for EBM. These are systematic reviews. The organization does not accept commercial or conflicted funding, also known as Cochrane collaboration. Medline, the U.S. National Library of Medicine premier bibliographic database, contains more than 26 million journal articles in the life sciences with concentration to biomedicine. These articles are from 5,200 current biomedical journals published around the world. PubMed is a component of Medline that contains more than 30 million citations of biomedical, medical, and other life science literature and abstracts. Cumulative Index to Nursing and Allied Health Literature (CINAHL). the world's largest source of full-text nursing and allied health journals. It's got more than 1,300 journals. CINAHL provides indexing of more than 4,000 journals. Grades of research evidence. Research evidence receives a letter grade: A, best evidence; B, C, D, poor evidence. Well-designed controlled experiments or experimental trials, double-blind RCTs, are considered to be grade A, or level 1 evidence. Statistical terms: the evidence-based medicine. CI is the measure of degree of certainty in a sampling method. An example of this would be 95% CI is a range of values that can be 95% certain contains the true mean of the population. Absolute risk reduction, or ARR, is a measure of the difference between two different treatments in terms of their ability to reduce a particular outcome, such as myocardial infarction and stroke. Relative risk reduction, RRR, a measure of how much risk is reduced in the experimental group compared with the control group. Number needed to treat, or NNT, the number of patients you have to treat to avoid one bad outcome. Again, an example is MI stroke. An example, an NNT of 7 means that it is necessary to treat 7 patients to avoid one bad outcome. Positive predictive value, PPV, the probability that a person with a positive screening test result has the disease. A negative predictive value, NPV, the probability that a person with a negative test result does not have the disease. Some epidemiology terms: active immunity, immunity to a disease developed either through vaccination or by infection. Passive immunity, immunity to a disease after receiving antibodies from another host, such as immunoglobulins. Examples is colostrum for breastfeeding that gives the neonate antibodies from the mother. Herd immunity, resistance to a disease in a large number of people in the population, which is usually due to immunization programs. Health, a state of which complete physical, mental, or social well-being. Horizontal transmission, transmission of an infecting agent from one individual to another, such as horizontal transmission of HIV and other sexually transmitted infections that occurs through sexual intercourse. Vertical transmission, transmission of an infecting agent from mother to infant. Congenital infections from mother to infant can be passed through vertical transmission. Again, HIV-positive mothers who breastfeed her infant can therefore infect her infant with HIV through vertical transmission. An endemic, a baseline level of a particular disease in a population. An epidemic, rapid increase of a disease in a population that involves a large number of people. A pandemic, an epidemic that occurs over a very large area, several countries or continents. It involves a large proportion of the global population. Morbidity, an illness of any departure from physical and or mental health. Mortality would be death. Infant mortality, infant deaths per 100,000 live births. The leading cause of death in an infant's first year of life is congenital malformation, including chromosomal abnormalities. Sensitivity, ability of a screening test to correctly identify a person with a disease. Specificity, ability to screen a test to correctly identify a person without a disease. So, some tips for the exam. Memorize the definitions of sensitivity and specificity. Learn the difference between an endemic, epidemic, and pandemic. So, we'll jump right into the questions. Again, let me know how you do in the comments. According to evidence-based medicine experts, which of the following type of research has the lowest ranking? A randomized control trial. B, an experimental study. C, a cohort study. Or D, an editorial. Number 2. Which of the following definitions describes the term specificity? Ability of screening tests to correctly identify a person with a disease. B. Probability that a person with a negative test result does not have the disease. C. Degree of certainty in a sampling method. Or D. Ability of a screening test to correctly identify a person without a disease. Question 3. Which type of evidence identifies, selects, and analyzes multiple research articles concerning a health condition, disease, or other health-related topic? A. A meta-analysis. B. A cohort study. C. Systematic review. Or D. Case study. Question 4. Which of the following definitions describes the term epidemic? A. A rapid increase of a disease in a population that involves a large number of people. B. Resistance to a disease in a large number of people in a population. C. Baseline level of particular disease in a population. Or D. Rapid increase of a disease that occurs over a very large area, which would be several countries or continents. And our last question. According to evidence-based medicine experts, which of the following types of research provides the highest level of evidence? A. A meta-analysis. B. A randomized controlled trial. C. A cohort study. Or D. An expert opinion. Alright, I hope you locked those answers in. Let's find out. A. Editorials. Editorials and professional society opinions are considered the lowest level of evidence because they are subjective and not based on research. Question 2. D. Ability of a screening test to correctly identify a person without a disease. Question 3. Systemic review. A systemic review, again, is a literature review that identifies, selects, and analyzes multiple research articles concerning a health condition, disease, or other health-related topics. Question 4. A rapid increase in a disease in a population that involves a large number of people. That is the definition of an epidemic. And last but not least, 5A. Meta-analysis, which is again the systemic review that offers the highest level of evidence. Alright, that is it for today. As always, I thank you for listening, and I'll see you at the next chapter. Till then, have a good day.